Hello, for today we have the procedure of measuring the pulse. The pulse is the expansion of the arteries on a hard surface. The main purpose is to evaluate the cardiovascular functions. For this procedure, we may need some materials like gloves, disinfectant, a watch, a pulse oximeter, a red pen, the patient's journal, and the infections container. The places where we take the pulse are temporal, carotid, brachial, radial, femoral, poplite, malleolar, and the PDS artery. Preparing the patient. We need to identify the patient, we verify his journal, we explain him the procedure, and finally we get his consent. The patient needs to be calm and relaxed, otherwise he needs to get rest for a few minutes before the procedure. We choose the most comfortable position for the patient, which can be in a chair or a bed. For today we use the chair with the backrest and the armrest, legs uncrossed, and the feet on the floor. First we need to wash our hand, to disinfect, and to put our gloves on. We can measure the pulse in 3 different ways. Manually, with the pulse oximeter, and with the electric blood pressure device. Manually, with 3 fingers, we count to 60 or 30 and multiply by 2. And with the pulse oximeter. Normal value is between 60 and 80 beats per minute. When we have upper values than 80, we have tachycardia, and when we have lower values than 60, we have bradycardia. But this depends on the patient's age. We write the values in the patient's journal with the red pen in 2 different ways, graphically and manually. And at the end, we clean the surfaces and we throw the gloves on the affected containers. Thank you very much.